Dr. Helena Pereira, thank you very much for receiving us in your hospital. For us at Sapa, it is important to know how the patients and the users of our hospital feel the advantage of using our systems. So for us, it is important to understand the importance to humanize the space, to use it as a welfare space. How can our systems contribute? What is important from your point of view from the systems to create this good environment?
First, I'm going to be very grateful for the questions you are putting me, and I want to tell you that the use of your supplies is very important because it can give us a nice environment with lots of light, a gay one, with the patient's mood. Our patient's mood is very important because we treat oncologic patients that sometimes are depressed because of the illness, and it's very important to have a nice environment and a gay one so they can feel better, because it's important to feel better, and it's important to feel that they are not in an hospital and they are not healed, they are trying to get better. And as you know, the mood of the patient is very important for the end of the treatment and what we expect with the treatment. We know that patients depressed have worse results than the ones that are well and are not depressed. So the environment is one of the most important things to be aware of, and we must be aware with the lights. In nowadays, everyone knows that there are several studies that are concerned with colors that hospitals should have, with the light the hospital should have, and when we build this building, we were very concerned with that, and one of the things was why not to have lots of windows, because the radiation oncology department always has to be in the
deepest parts of the building.
Yes, the building. So we want a department that is in the surface and has light to be gay, to be beautiful, to live here, because we really live here more than we live in our own houses, because we are here 30 hours a day, and the patients almost live here when they are being treated. So it must be beautiful, lightning, and all those things. And the windows, we have lots of windows, we have lots of light, it's very important. At the same time, it was very important to have a nice environment with no cold, lots of...
So with a good control of temperature.
Okay, because the whole department was very hot and very cold, so this is a very good way to work with this kind of temperature.
So you feel comfortable in
yes,
this building?
Yes, it's very comfortable and cozy and very gay and so on.
Yeah, okay.
Yes.
Thank you. So it's important that you save also some money from getting solutions that really save energy.
Yes,
is also
very important
for you?
For the direction of departments, is very important not to lose money with the resources like heating, like light, like getting the old department cold when there is warm outside. So we don't spend so much money with the temperature of to maintain the temperature of the department.
Okay, that's good. So another point that is important to us is environment in terms of asepsy, in terms of cleanness.
Yes, it's easy to
it's
clean it's
too,
very easy to clean surface with glass because it's very easy. It's easy, and it's easy to identify if the surface is not clean because the glass has that kind of easy way to identify the what is not clean. So and at the same time the glass is very insonorized. It's easy to work here, and I don't hear what my fellow in the next room says. It's no sound is passing through the rooms. It's important. It's a very good thing. When we build this area, we have an area that's dosimetry that has a big window for the outside of the building and inside of the building. And someone said, you are going to hear everything that is in the room, but really don't hear a thing. It's very important.
And what's the feeling of your patients? Do they have any reaction in terms of the space, in terms of the services conditions?
Yes.
How do they react to this very lightful, clean hospital
They
we have
appreciate
here?
very much the building and space, and they are very pleased because they say that it does not look like an hospital. It's very nice to be here. It's not an hospital. It's a place like an airport because our administration has the idea to put the seats like the airport of Oporto. It's the same. So they came and say, oh, this looks like this does not look like an hospital. It looks like an airport or something like that. It's very nice to be here. They like.
Okay. Thank you very much. Now I think you may invite us to visit some spaces where we can
I'll be very pleased.
some spaces.
I will be very pleased.
Can you make a statement in terms of inviting us?
Yes, I want to invite you to visit our department and see how nice is the different areas that we have where we work and where we make our patients wait for the appointments and where we can simply eat our meals.
Thank you very much for the invitation.